Have you ever seen a child with an unnatural head tilt in one direction, with their chin pointing in the opposite direction? This is usually diagnosed as torticollis. 3 years ago, a friend of mine had a baby, and she noticed that her baby was always tilting her head in one direction, with her chin pointing in the opposite direction. My friend questioned her pediatrician about her daughter's head tilt, and her daughter was later diagnosed with torticollis. Unfortunately, the pediatrician did not share much information about this disease with my friend. So we decided to go online and do some research so my friend knew exactly what was wrong with her daughter. Today, I'm going to share with you the causes and symptoms, how the disease is diagnosed, and the different treatment options for torticollis that we found 3 years ago for my friend. Torticollis has two main causes. One cause is a faulty gene when the child is conceived. The other cause is a trauma at birth that causes bleeding in the neck muscles. This was the case with my friend's daughter. She had an extremely difficult delivery with her daughter, which caused damage to her daughter's neck muscles. There are many different symptoms of torticollis. The main symptom is a head tilt to one side with the chin pointing in the opposite direction. This is the case with my friend's daughter. As you can see by this photo, my friend's daughter clearly is tilting her head in one direction with her chin pointing in the opposite direction. A few other symptoms of torticollis are limited range of motion. They can have headaches. There's neck pain. One shoulder can be higher than the other shoulder. There can be stiffness in the neck muscles, and there can also be swelling of the neck muscles. There are a few different ways that torticollis can be diagnosed. The main way torticollis is diagnosed is with a physical examination by a doctor or a pediatrician. Sometimes they may order x-rays of the child's neck. They may also need to order an MRI if the child is displaying developmental delays. There are not many treatment options for torticollis. The main treatment option is stretching the neck muscles. This is usually successful if it is started within the first 3 months of life. Another treatment option for torticollis is surgery. They usually perform surgery on patients with torticollis when they are in their preschooler years. And they only perform surgery if the other options have failed. Another option is a neck brace. The neck braces usually only help with muscle spasms, and they do not correct the problem permanently. Another option is to put the cervical spine into traction. These are the causes and symptoms, diagnosis, and different treatment options I showed my friend when her daughter was diagnosed with torticollis. In my friend's case, she was able to take her daughter to a chiropractor to stretch her neck muscles. If you would look at her daughter today, you could not tell just by looking at her that she has this disease. However, my friend's daughter will still have problems holding her head straight when she is not feeling well and coming down with a cold or flu bug.